Hi, my name is Emily Carlson, and I'm going to be talking about assessment and treatment of attention deficit hyperactivity disorder. So, the content I will be covering in this presentation is what we know about ADHD. This includes the prevalence, the typical behaviors of individuals with ADHD, and the common treatments for the behaviors. I'll also talk about gaps and barriers, including research on function-based interventions and functional analysis, and the manipulation of the quantity and quality of reinforcers as a treatment. I'll also discuss an action plan to address these gaps, steps the field of ABA can take, and steps that I can take. So, what we know ADHD is a psychological disorder that is diagnosed by psychologists. According to the CDC, as of 2019, about 9.4% of children in the United States are diagnosed with ADHD. That is about 6 million children. In 2016, Parents Survey reported that 6 in 10 children diagnosed with ADHD were diagnosed with an additional disability or disorder, such as another behavioral disorder, autism spectrum disorder, Tourette's syndrome. I've actually worked with several clients on the autism spectrum who are also diagnosed with ADHD. The two typical behaviors exhibited by individuals with ADHD is inattention and impulsivity. Inattention can be described as off-task behaviors, such as getting out of the seat, walking around, looking out the window or not at the task, tapping pencil, or fidgeting with materials or in the seat. So basically, doing anything that is not assigned task or expected behavior is considered off-task behavior. Impulsivity can be defined as behaving without prior thinking or reflection. This may include drawing or writing on materials that are not supposed to be drawn on, spitting on items or materials that are not supposed to be spit on, like tablets or books, and taking one's clothes off in inappropriate locations, such as public settings like the park or classroom. One of the clients I worked with who had a comorbid disorder of autism spectrum disorder and ADHD, when his parents decided to change his medication, we saw a lot of increase in his impulsive behaviors, such as he would color and draw on the walls in our clinic or on the table, which is not something you're supposed to be drawing on. And he also would just randomly spit on items. He'd be reading a book and he'd just spit on the page. Some of the most common treatments for ADHD is medication and behavioral therapy. The most common treatment is medication. This can include stimulant medication like Ritalin or non-stimulant medication. In 2016, 62% of individuals diagnosed with ADHD received medication as treatment, with 30% receiving medication alone. The second most common treatment for ADHD is behavior therapy. In 2016, it was reported by the CDC that 47% of children diagnosed with ADHD received some form of behavioral treatment, with 15% receiving behavioral therapy as treatment alone. The most common behavior treatments studied and researched are self-monitoring management procedures, self-control training, and choice interventions, such as choice in reinforcer preference and choice in task sequence. Gaps and barriers. As you can see here, we have several pictures of different gaps or barriers. We have a puzzle with a gap in it, missing puzzle piece. We have a street with a barrier in it, and of course, one of the greatest barriers, the Great Wall of China. One gap in the research of ADHD is the study of and use of function-based interventions and functional analysis in changing behaviors of individuals with ADHD. Although some research has been conducted on function-based interventions for individuals with ADHD, more research needs to be conducted using functional behavior assessments and interventions based on function of the behavior. Every behavior has a function, and identifying the function of the behavior first can lead to more effective treatment. Another gap in the research of ADHD is the study of manipulation of quantity and quality reinforcers. That is delayed versus immediate reinforcers and large versus small reinforcers. So some research has been conducted on this. This research mostly focused on time delay, so like I said, immediate versus delay reinforcers, and the magnitude reinforcers, small versus the large reinforcers. In a study done by Robinson and St. Peter in 2019, the experimenters studied the effects of accumulated delay large reinforcers and distributed immediate small reinforcers on academic responding and problem behavior in 3 school-aged students diagnosed with ADHD. Robinson and St. Peter found that all 3 participants engaged in higher rates of academic responding in the accumulated delayed large reinforcer condition than in the distributed immediate small reinforcer condition. Robinson and St. Peter also found that all 3 participants engaged in lower rates of problem behavior in the accumulated reinforcer condition. Robinson and St. Peter's findings in 2019 suggest more research needs to be conducted on the impact of quality and quantity reinforcers, such as larger delayed versus smaller immediate reinforcers. Action plan. So as you can see here, 2 of these pictures are barriers being taken down. Actually, those 2 pictures are also the Berlin Wall being taken down. That was another famous barrier. The other picture is about research, because research, it can always be a great part of an action plan. So what can we do? To address the gap on research on function-based interventions, the field of ABA can continue to study and research the use of functional analysis and function-based interventions in changing the behaviors of individuals with ADHD. The field should focus on the implementation of function-based interventions to increase and support fidelity of implementation of these interventions. To address this gap of functional-based interventions, I can continue to read the research and literature on these interventions and share the findings and apply my knowledge to my job. To address the gap on the magnitude of reinforcers, the field should continue to study the research this intervention. While the field has conducted basic research on magnitude reinforcers with non-human subjects, the field should provide opportunities for this research to be shared with applied audiences. The field should also continue to conduct this research with human subjects in applied settings. For this problem of manipulation of magnitude reinforcers, I can read about translation research and how basic research is translated into applied. This can help me bridge the gap between basic research being conducted and experimented on in applied settings with human subjects. I can share this information with other colleagues and disseminate my knowledge and findings with applied audiences. Here are my resources that I used. And thank you for listening.